Hi, I'm Meshal Malik, and you're watching Indus Special. Schools and universities were some of the first institutions to close down as countries imposed restrictions to try to contain the coronavirus outbreak. Now, almost 3 to 4 weeks into this global state of paralysis, how are teachers and students coping with the changes? On today's show, we take a closer look at how the situation is unfolding, especially in the United States, which has become the epicenter of the virus. Joining us for this discussion is Hamna Tariq, who belongs to the Trinity College in Connecticut. She is these days in Lahore, Pakistan. She's going to be talking to us about her experience as what happened as the outbreak first erupted. Also joining us today is Mr. Carl Hooker, who's an educational consultant. He is joining us from Texas. Thank you both for joining us and a very warm welcome to the show. Mr. Carl Hooker, I'd like to begin with you. Now, when we take a more holistic overview, there has been some time since schools and universities have been shut down. Students and teachers have been trying to adjust to the change. How do you think that's going so far?
Well, I would say it's going clunky at best. A lot of schools here were not prepared for this, obviously. I would say the schools that are doing the best in that situation are the ones that have had maybe some sort of mobile devices in hand for the students beforehand. So a lot of those schools just sent those devices home with kids. Now, that being said, when it comes to learning, online learning is a completely different situation than face-to-face learning. So a lot of these teachers are really just what I would call triage when it comes to actually trying to teach at home. And of course, parents are now thrust into the role as educator as well, which has made it all a very bumpy transition, to say the least.
Now, with this bumpy transition, and we keep hearing about the host of issues that teachers and students alike have to face. What is the expectation? What is the outcome of this process? I mean, would you say it would have been better to just jump into holidays instead of continuing these classes?
I'm actually very impressed with what the teachers and students have already come up with. Even though I say it's triage and it's been bumpy, for the most part, a lot of this needed to take place anyway. So in some ways, having this opportunity to now experiment with what real, true blended learning looks like has been a little bit of a blessing in the sense that now teachers are kind of forced into the use of some of the tools that, of course, we've been trying to teach our teachers for a number of years. And it's actually benefited in some ways in the sense that they're picking up on more of these tools. My hope is that in the future, when we come back and things are set to normal, that they will continue some form of this in an online form. I think it's a great tool to have if done correctly. I will say, again, there's still a lot of teaching when it comes to how to actually provide online learning. And I think that part still needs a lot of fine tuning because it's really not just here's a digital worksheet and I want you to fill it out and send it back to me. But I think that's what most teachers are doing just because that's what they're familiar with.
Right. Mr. Stay with me. I want to jump back to you and talk to you more about the teaching aspect of this all and what are some of the struggles that can be worked on to improve if this situation continues to persist in the coming months. Hamna, I just want to talk to you a little about your experience. Now, you were previously in the United States, you were finishing your degree, and you were to graduate in 2020. But having this happen, how has that disrupted your program so far?
It's been unfortunate, to say the least, because like you said, I was set to graduate in May 2020. And then in March 2020, I was encouraged to go back home. And for me, home is not the United States. Home for me is Pakistan. So that was a huge commitment for me to come back home, pack everything I have. And I don't know when I'll be going back. So definitely disrupted my entire life in a way. Right. Most of my classes, like Mr. Farooq said, are online now. They're on Zoom, which has its pros and cons because there is a time difference. I'm in Pakistan. Those classes are being held in the United States. So those classes might be in the morning in the United States, but for me, that's night. So my day starts at night and ends in early morning. So, of course, this has disrupted my whole lifestyle. Right.
I can imagine how that would be such a huge change, not just the time difference, but also the fact that, now you're remotely interacting with all your teachers and professors and students. Just take me through the learning aspect of that, especially when we're talking about whether it's not comparative to what it was before, but how much do you feel like you're absorbing given the entire anxiety that surrounds the situation and also how this has become now a remote way of interacting?
I think that's a great question. For me personally, it is hard to learn online because I am taking language classes. So when you're in a language class, you need to be in class to communicate in that language with other people. So that doesn't translate through a Zoom call.
Right.
I am writing a thesis, but most of my books are in the United States, in my college's library. So, of course, it has been a rough transition. Luckily for me, and I know for a lot of my friends who are in different liberal arts colleges around the United States, our colleges have been flexible in the way that if I can't attend a class, my professors will be flexible and ask me to attend some other time, which depends on, of course, which time zone I am in. But still, like for me personally, I haven't been able to absorb a lot because when it comes to learning, I feel like it should be in person. There's a lot that you gain when you're in person than when you're on Zoom. And also a lot of people don't have access to the internet 24/7. So as a result, they're missing out on this important learning. So for me, I would say it's 50-50%. Like I'm not disappointed with it because I know my school's trying its best. But at the same time, I am not absorbing as much as I used to.
Right. That point where you're talking about the lack of internet access, how problematic was this, especially for students in the United States where there is a greater coverage of broadband services? How problematic was that for your peers? Did you witness occasions in which this was put out as a frequent complaint?
Even with students who live in the United States, but they live in more, I would say, not as advantaged areas, they didn't have access to internet 24/7. And even just to add on to this point, there are lots of people who can't take classes at home because of their family structure.
Right.
So there might be one laptop in the family and everyone has to use that laptop. Or you might be living in a one-bedroom house. So as a result, you can't really quietly communicate with the entire class.
Right. Hamna, stay with me. Right, stay with us. I want to quickly jump back to Mr. Hooker and talk to him about this. Mr. Hooker, given the entire digitalization we've been seeing over the years, isn't this surprising that when in an emergency situation, there needed to be this transformation, this overhaul all of a sudden? Still, we see that internet inaccess is such a huge issue. Or was this to be expected?
This inequity has been around for a long time, and a lot of my colleagues, we're not surprised by what the problems that we're facing now. We've been kind of calling for this to happen a long time ago in terms of getting access in the homes of students. And unfortunately, this has just shed a very bright light on that inequity. And so there are, as the student mentioned, there's a lot of areas, rural areas in the United States that do not have access to broadband. And so what a lot of the leaders are doing is they're forcing to just kind of send home hotspots. They're asking local internet service providers to provide free for K-12 students some sort of internet access. But also, like she mentioned, the family structure is very interesting. I have a friend who has 8 school-age students in his home. And for one device for 8 kids, that's just not going to work when it comes to each of them trying to get their schoolwork done. So I think there's a lot of inequities, and I think this has shed a very bright light on that that we need to overcome quickly.
Right. Definitely. That is something that is being echoed all across the world. This inequity that always existed within the system, it's just now becoming more pronounced given the pandemic, given the situation we have. Hamna, just one last question to you now. You talked about your graduation and you talked about how it was supposed to be held in May. Now, give us a brief insight into how your university, your institution is dealing with this sudden outbreak, how they're going to help students graduate, and especially given the travel situation. We know a lot of people are stuck in different places given the travel restrictions.
So my school specifically has decided to postpone graduation till May 2021, which is, of course, more than a year from now, and that has disrupted a lot of people's education as well as travel plans. But luckily for me, my school is ready to pay for flights. So for example, if I have to go back to the United States in May 2021 for my graduation, I can go back because my school has agreed to pay for my flight. But then the visa status matters. What if my visa expires by then? So for international students, this is a very tricky stage to be in. But for me, my graduation is in May 2021. I am slightly disappointed because it's a year from now, although I had to graduate in May 2020. But I'm glad at least I'm having some sort of a commencement ceremony and it's not entirely online.
Right. Let's just hope things get better and better till then, and we don't have to be faced with travel restrictions for too long. Thank you so much, Hamna, Tariq, for joining us and talking to us. Mr. Hooker, going back to the point about inequities and how you said that you and your colleagues are not surprised that this exists and this is becoming more apparent now. Now, of course, focusing on this and talking about the digitalization, the need to integrate technology is something you've been advocating for a long time. Why do you think there was such a pushback against it, such a hindrance to actually accomplish that goal?
I think what happens is that people need to really feel like there's a necessity for it. And I think in terms of until it solves a problem for them, they feel like, well, we can continue to do the traditional face-to-face. And you heard it from Hamna there. You know, face-to-face is still a great way to have teaching and learning take place, and I advocate for that as well. That said, the blending of that educational technology, and I think that it wasn't seen as a necessity. It seemed like as a luxury to have in terms of letting kids have some sort of digital access. Mm-hmm. And until this happened, I think people really thought that was the case. And now I think they're starting to see that. And of course, when it comes to funding, hopefully in the future, they'll think about ways to provide that kind of access to students well before anything like this happens. Because my guess is it'll probably happen again in some form or fashion, and hopefully we'll be much more prepared for it when it does.
Right. I want to talk a little about how you think this entire situation is going to impact the global educational landscape, because we know that in many ways the United States has become a place that many students desire to go for their higher education, especially. It has an enormous amount of international students present there. So what happens? They're adopting as new educational techniques and ways to go about things that will create ripples across the world. What are some of the trends you expect to see once this thing is over?
I do think there's going to be more of a shift to having more of a flexible classroom in terms of both the schedule face-to-face, but also online. And I think what's going to happen with a lot of teachers is they're going to realize that they have access to tools that they've had the whole time that they can then use to enhance what they're doing. So I do see probably an uptick in terms of that instructional technology usage. And when it comes to the online part of it, I'm not sure what that looks like yet, but I can tell you this: there's definitely a lifestyle change happening here in the United States, where people are starting to realize that maybe they've been running a little bit too fast in terms of, you know, the 40-hour work weeks and not a lot of time with family. And I think a lot of them have taken, what this pause has caused is a lot of people to take a step back, take a breath, and think, right, maybe we're living life a little too fast. And when it comes to education, my hope is that it adds some level of flexibility. I don't know what that looks like right now. It could be that, you know, maybe we're only doing a 4-day school week and we have a 1-day online, or maybe a part of the day is online. I think that needs to happen in the future, and I think it helps families.
Right, there is going to be change coming about after this entire situation. I take your point there. Thank you so much, Mr. Carl Hooker, for joining us from Texas. Now joining us is Mr. Mark Meirowitz, who's a professor at State University of New York Maritime College in New York. He joins us now. Thank you so much, Mr. Meirowitz, for joining us. Hope you and your family are well. Now, New York has become the epicenter of this outbreak. We are seeing the most severe and dire situation unfold over there. Now, talking about how this has impacted universities, higher educational institutions, especially in New York, what are some of the dominant trends you're witnessing?
Well, first of all, what we experienced was a very precipitous transition by the colleges to online, which was quite complicated and difficult when you are teaching an in-person class to transition. We've been able to accomplish that transition, I think, very well. But I feel that, and if I may be a little bit contrary to what the previous speaker discussed, is I don't believe that this method of learning necessarily has all the full advantages. It also has many disadvantages. And those disadvantages is that you're missing the interpersonal interaction in the classroom. That is very important to learn, to get to know the students. The way in which you teach and keep students' attention is somewhat diminished, right, in the online forum, because I can't keep track of. I have 20 students sitting in their homes, and not all of them have videos. So I have basically blank screens and some videos, some students on video, and I'm doing what I'm doing to impart the material, but I don't always know that they're all connected and right, paying attention, which I can do in the personal classroom. As far as the lifestyle change, I'm not so sure that this is the most desirable lifestyle change, and certainly under these circumstances, because what we're finding is that many of our students are, like the professors, are facing challenges in life, family challenges, being at home with family in difficult situations, for the students and for the faculty. So this atmosphere is not necessarily conducive to be a model.
Right. Ms. Meirowitz, sorry to interject here, but everything you've listed are problems that we are hearing about on social media. We're hearing from our friends, students who are currently enrolled, and they are all very legitimate. Now, the follow-up question to that is, how will these students be graded? What is the expectation here? Will they be penalized for their poor performance in this term? What are professors doing to grapple with some of those more numerical or more necessary steps that need to be taken in order to continue the term, in order for those students to be able to continue their degree?
So first of all, under these extraordinary circumstances, many of the colleges, certainly in New York, have made provisions, for example, to allow students to opt for pass-fail. If in one college, the professors opt for it, in other colleges, all students have the right to pass-fail. In some colleges, students have the right to finish the semester and then basically withdraw. There are many flexible things that the universities are doing because of the pressing issues for students and faculty. As far as the work is concerned, I don't think necessarily that there's any diminution or lessening in the quality of the education. I mean, we can do online exams through Blackboard, and we can do, and we have take-homes and essays, which we would ordinarily do in classes that meet in person. So we continue, and we can use Zoom and Skype and other modalities to continue the lectures. My lectures have continued unabated, without interruption, since this occurred. Now, again, is it the same as having, we said before about in person? Well, no, but what we're trying to do at the present time is to get through, to finish the semester with a quality education.
Right, Mr. Meirowitz, I'm going to jump in here, and I have to introduce another guest who's just joined us, Mr. Peter Lee, who's an associate professor of political science at the University of Houston in downtown. He's joining us from Texas. Thank you so much, Mr. Lee, for joining us. Now, you must have heard a part of what Mr. Meirowitz was talking about, the alternatives that are existing here in order to continue the degree. Earlier, we talked about how many students, many international students, many other students who don't have access to the internet are suffering on account of this. How do you think, what's your take on how professors can accommodate those students, how institutions can accommodate those students?
Now, in the United States, we also have seen the problem that students, about 17% of the students, nationally, have access issue, technological issue, and also, equipment issue. And one of the solutions is that, students could have access to, government and institutional supported, equipment like, a router, facility, and also, students can talk to the teachers via email if they cannot, access the online course at the time when the class is on. But of course, teachers are more readily available. In the case of myself, I check emails all the time and to make sure that the students, if they, for whatever the reason, they miss the class, they can access me and I can provide the class notes and also, answering the questions by email. If they can call me, that would be another, way to do it.
Right. Surely a lot of professors are showing that flexibility that's needed during this time. Mr. Peter Lee, I want to touch upon the subject of international students. Now, a report that was issued by the Institute of International Education talked about how 5.5% of the U.S.'s higher educational population is belonging to international students. Now, what are some of the unique challenges they're facing? And do you think that governments and especially embassies are helping to coordinate and cushion and mitigate the impacts of those things that these students are facing?
For students, as far as I know, from China, the embassies and the consulates in the United States are mobilizing, local Chinese American community to provide assistance. And also, the schools have been, mobilized, to help these students whenever they can, and in whatever the method that is available, under the government, under the schools, control. So we see, yes, we have taken notice of that issue.
Right. Mark Meirowitz, now with all these issues we're seeing, a number of which you also pointed out, of course, there are holes within the system, like in any system, but in terms of education and the entire architecture of it, many things are becoming more and more pronounced. Is there a conversation, is there a discussion amongst faculties and institutions of what they're going to do once we get over this pandemic? Are there going to be targeted efforts to fix those inequities we see right now?
Well, I mean, right now, as you pointed out, it's an emergency situation. But if, for example, on Zoom, if the student doesn't have internet, they can call into Zoom and participate fully in the class. The students can call me anytime, as the professor indicated, with email. I have email, phone, keeping in touch with the students. And I really do make sure that if I see that students are not attending, I reach out to them to find out what their situation is. And again, there are various family situations. If you're asking me about the takeaways from this, I mean, if hopefully we get through this soon, we need to do a lot of reflecting, as you indicated, as to where we had pluses and where we had, successes and where we needed to fix things. But again, you need to keep in mind that the situation is so unique and so pressing that it's very hard to do a lot of concentrating right now. We just want to get through, finish the semester at this point, the spring semester, and get all the way through and finish the class and allow the students enough flexibility, as I mentioned with PassFail, et cetera, to allow them to be able to complete their work and move on. And that is the main focus at the present time that I believe universities are putting their efforts into. And they're also planning for the future, because what universities are doing, as are corporations and other institutions in society, are trying to figure out what do we do when this is over, and how do we transition back to normal procedure. Right. And that is going to be very, very, very difficult, because we don't know when it's going to end. And because we don't know when it's going to end, it's very hard to plan semesters. And universities actually, in a way, have an advantage, because we have this Zoom modality or this call-in modality and email and contact with students, and we're able to create even this online cohesion with the students, which in other sectors of society, people are home alone, they have no social interaction, social cohesion. So I think we were actually lucky that we had this technology, because just imagine if we didn't have the iPhone, the computer, the Zoom, the Skype, all these modalities, how would we function? We'd be sitting at home and just looking up at the sky and not knowing what was going on. So it also connects us to institutions, and we're lucky to have it. So I think that, as again, with all technology, it has its advantages and disadvantages, and I think we just have to try to keep pressing for the advantages and try to, as you say, avoid the disadvantages.
Right. Mr. Meirowitz, I take your point, and that's an essential point, that many teachers and institutions are focused on what's happening right now, trying to get through the system. But of course, it's important to reflect on the situation, the current system, in order to improve it, because if we will see, God forbid, another pandemic soon enough, we have to be prepared for it. Thank you so much, Mr. Mark Meirowitz, for joining us, Mr. Peter Lee for joining us. We're going to go for a short break. When we return, we talk about how deeply COVID-19 is expected to change our lives for the future. Stay with us. Welcome back to the show. Now, with global infection cases hitting almost 2 million and more than 114,000 deaths, the pandemic has swallowed the world whole. Many countries, including the United States and those worst impacted in Europe, are hoping that they have reached their peak. This, of course, has spurred conversation about how the world will move forward post-COVID-19. On today's show, we talk about how this pandemic is actively getting us to reevaluate social dynamics and whether the social impact of what we are seeing now will last long after the pandemic is over. Joining us for this discussion is Dr. Meshal, who is associate with the Brookings Institution and is professor of sociology at the University of Maryland. He joins us from Washington, D.C. Also joining us is Professor Julie Leask, who is a social scientist at the University of Sydney Nursing School. She's an expert in public health and infectious diseases prevention behaviors and advisor to the World Health Organization. She joins us from Sydney. Thank you both for joining us, and welcome to the show. Professor Leask, I'd like to begin with you. Now, COVID-19 is dramatically altering all our lives right now, but do you see the impact being one that will cause permanent shifts in our lifestyles and behaviors even after this is over?
Yes, absolutely. This is an event that hasn't been seen in the world for 101 years since the 1918 pandemic that swept throughout the world. And of course, it's no secret that we will have incredible impacts on the way we live and work, on our health, in many different areas of life. I'm thinking particularly of our health and just the mere recovery from the deaths from COVID disease and the post-traumatic distress of healthcare workers, which we know has happened from previous epidemics, that will be something we have to deal with.
Now, just focusing a little more on that we know that the burden of healthcare will continue to increase even after this pandemic is over, because as you mentioned, once we deal with this, we're going to have manifestations all over of those who are suffering from post-traumatic stress disorder. What do you think is the international conversation about global institutions dedicating greater funds to healthcare? Is there a conversation? Do you hear that happening right now?
There's no doubt going to be a conversation. Of course, we're going to see greater attention paid to public health in general. Pandemics shed light on existing brokenness in health systems. And this is shedding a great big spotlight on all sorts of cracks in systems. So we will see increased funding, particularly for pandemic preparedness.
Right.
We'll see hopefully increased funding for health systems and infrastructure. And I certainly hope that we see great attention, ongoing attention paid to increasing immunisation rates as well, because it's not just, of course, the COVID disease which causes outbreaks.
Right. Definitely. Stay with me. I want to jump to Tariq Ray and talk to him a little more about these cracks that we're witnessing all over the world now. Dr. Ray, one of the things that has become very evident is the way we interact, or the fact that our travel and trade has evolved in a certain manner, is unsustainable. Do you think we're going to see shifting patterns of how that's done once we jump back or try to jump back from this?
Yes, I think that we're definitely going to see huge shifts in how we navigate society. So what people knew of life to exist in 2019 and before is going to drastically change, as we just heard. And I think we definitely have to look to the Spanish flu in 1918, as it was called, but also we can look to 9/11 and what happened in 2001 and how that had a seismic shift in what happened over the past 20 years or so. We're seeing that same thing with COVID-19. I think particularly we're going to see changes as it relates to trading between countries. The United States is fundamentally realizing the detrimental effects of relying on only a few countries for a large number of products. I think that's going to have a drastic impact not only on trade and the economy, but also have an impact on immigration. What we're seeing is a rolling back of immigration policies in the United States and around the world. I think that will continue. I think we'll also continue to see a ramping up of surveillance. If we look at what's happening in China, for example,
right.
I mean, they have really went to the extreme of surveilling people. And I think we're going to see shifts there. I think we're going to also then see shifts in work and education. Part of what that means is more reliance of doing things like this, doing things online. Is going to roll back a lot of in-person type of interactions, particularly as we move toward a vaccine. That's going to take a long time to ramp up. Scientists are also estimating that we might see another huge outbreak in the next 5 to 10 and maybe 20 years that's going to continue to change things. And so I think that that life as we've known it to exist before 2019 will no longer exist today.
Right. A number of very interesting points you put put there. And I just want to follow from that of surveillance. And I want to jump to Professor Leask and talk to her about this. Now, prior to COVID-19, we saw discussions mostly surrounding social media and many other surveillance networks. The ethics of the entire thing was being questioned. But now we're seeing a need for these surveillance systems, especially when we talk about tracing and trying to tackle the pandemic. How do you think countries are dealing with those ethics, that question of ethics, whether it's ethical to create these surveillance networks and how important it is to create them in this present moment?
Yeah, there's a real hazard that in the rush to do things that are good with technology, such as to be able to very rapidly trace the contacts of people with COVID disease and let them know so they can quarantine themselves. Technology can help us do that, such as with our phones being able to locate people within our radius, enable that to happen. But of course, that is a two-edged sword, and it needs to come with many different considerations and protections in place so that those sorts of technologies don't end up being exploited in a way that might be harmful ultimately to citizens. So there's a real fine balance to keep there.
And we're talking about that there needs to be this conversation, there needs to be a recognition that this can be a double-edged sword. But do you think countries can afford to have that conversation, given that right now the main aim is to tackle the situation?
Look, it depends on the country. Certainly in Australia, we've been able to, as our Chief Medical Officer said, get on a lifeboat and now navigate the course on that lifeboat.
Right.
So there's a little bit of time to think carefully about how we do things next. We're always dealing with uncertainty, but there is some hope in technologies that can enable this rapid contact tracing. And being in a rush is no excuse for not thinking a little bit carefully about what sort of implications that has and what sort of precautions we need to put in place. There's a lot of focus on privacy here, but of course there are equity issues as well that we need to consider. Can all people who want to travel access a smartphone, for example?
Right, that is an important point you put there, equity, and how we need to bring that into the conversation. That brings me to my next question. Dr. Ray, I'd like to put this to you. Now, last time we had you on the show, we talked about racial disparities, how they're manifesting and becoming more prominent within the United States, especially when we're talking about COVID cases. Now, there is enough evidence to confirm the fact that there indeed is a disproportionate impact on African Americans within the United States. Do you think that what we're seeing right now will having a lasting impression on especially the social footprint and the milieu, complete milieu of the United States?
Yes, unfortunately so. I mean, part of what COVID-19 is highlighting are the inequities that exist not only in the United States, but around the world. And what people really have to understand is that when pandemics or crises occur, they don't reduce inequality. They don't always bring us together more. There are some people doing that. But instead what they do is they exacerbate inequalities that already exist. So in the African American community in the United States, there were already extremely large health inequalities between blacks and whites. COVID-19 simply further expands that and highlights that. And I would like to hope that moving forward, there will be some life lessons. There are a couple things that people really need to focus on. First is there was a global health pandemic response report that was put out of nearly 200 countries. People can look through that. It was a range of factors, a lot of different variables they looked at. In the U.S. context, there was something really, really big to pay attention to. U.S. ranked number one. It was only at 84%. That's not great. Like in my world as a professor, that's only like a mid B. But they scored extremely low when it came to healthcare access, healthcare inequality, actually scored in the 60th percentile. And so part of what we have to look at is the ways that an outbreak are actually increasing inequality. And in the Black community, part of what's happening is there are not testing sites, in Black communities. Black people are being turned away from being tested, and then they're being sent home to die in communities that don't have the proper resources to actually deal with this. So what we need is like what New York Governor Andrew Cuomo is doing. He said the other day that he is going to start putting testing places and triage places in predominantly Black and Latino communities. That should have happened months ago.
Right.
But now that we're behind the eight ball, hopefully we can catch up and try to actually reduce the number of deaths that's happening in Black communities.
Right. That, of course, is the greatest hope, that no one should not have access to healthcare because of their race or gender or any other factor, any other social determinant here. Everyone at this point in time should have access to adequate healthcare, to testing. Thank you so much, Dr. Rayshawn Ray, for joining us and talking to us. Professor Leask, now, talking about universal health coverage, the World Health Organization had set 2030 as a goal for that, and it said that we need to double our access to healthcare, or 5 billion people will be left behind by 2030. Now, we hear many countries talking about how they're going to do this in obscure ways. Do you think this will shift more focus to the importance and need to do that right now? I mean, how many people are being left behind during this pandemic?
Yeah, look, of course, it's impossible to quantify that. As Dr. Ray said, there is certainly an intensification of inequality in access to healthcare and resources through this pandemic. It's very hopeful that universal healthcare will be a thing of the future, will remain to be a thing of the future. Of course, so many different things in global health have been put on pause while we manage this pandemic. But afterwards, I suspect there'll be a reasonable appetite to continue to aim for that, given that universal access to healthcare can indeed intensify our security against pandemics and outbreaks in the future.
Right. Please, just one last question to you. Now, what kind of data do you feel like needs to be collected during this time in order for, once this is over, for us to have better knowledge of what happened, what went wrong here, in order for us to make pandemic preparedness more robust for the future?
Related data, the kinds of data that measure psychological and social impacts of the pandemic, the impacts of losing jobs, of isolation, mental health impacts, impacts on mortality from other diseases, because people in some countries, of course, will be missing out on access to healthcare. And, of course, keeping a close eye out on our immunisation rates, because it still remains important that children and adults are immunised according to their schedules. So the other thing that's important to do is take notes on what we're observing and all the issues and problems that are arising as we go, because while it's fresh in our mind, we need to note where the failures and problems and issues are, just simply in relation to, say, communication between agencies, for example. So taking notes now, because once this is over, and obviously the pandemic is going to be a long haul by the look of it.
Right.
Once it's over,
need all that data for introspection afterwards. Thank you so much, Professor Julie Leask, for joining us and talking to us. I'd like to introduce Professor Kerry Cooper, who's a professor of psychology and health at Manchester. He joins us from Manchester. Thank you so much, Professor Cooper, for taking out the time. Now, we've been talking about the implications on mental health that will emerge and will become more prominent after this pandemic. What are some of the trends we are seeing right now? What are some of the things that you're hearing from patients, from many of those who already had underlying mental health conditions during this time?
I think we have lots of issues. I don't think it's just about patients who pre kind of COVID-19 had mental health problems. I think there are quite a lot of people suffering at the moment and will continue to suffer the longer this goes on. In other words, you think about the thing that causes people more ill health, mental ill health than anything, is two major factors: uncertainty and lack of control. So we have uncertainty about when this is going to end, and we have the threat of this, as many researchers are saying, that may extend over the next 12 months. So we have that uncertainty. And because we don't have enough testing, We don't have enough antibody testing to see whether people have had it and have developed some sense of immunity. And the other thing we have is very little control over events, and governments are controlling us. Those two factors lead to mental ill health, or they lead to anxiety, and in many cases, depression. But so we have people who have had that before and are feeling even more insecure, and then we're having a whole load of new people. And then there's another third group I'm very worried about, which is the healthcare professionals who have been exposed to massive stress trying to cope with this. In addition, seeing lots and lots of people dying particularly for the frontline staff. And I'm worried not so much now as they're trying to cope and deal with this. I am kind of concerned about that. But further down the line, there's likely to be post-traumatic stress, PTSD, among healthcare professionals who've been exposed to very high levels of stress and death.
Right. Professor Cooper, like you, many other individuals, many other professionals who deal with mental health are already predicting this. Now, my question is, before this hit us, we didn't talk about pandemic preparedness a lot, but now that we're in it full-fledged, we keep talking about pandemic preparedness, and if we were prepared better, we would have been able to deal with it better. When it comes to mental health, are there ways that we can prepare for what's about to happen in the coming months right now, given the situation? Are there ways that the mental health experts all around the world can come together, the international community can do something to deal with the situation when it does inevitably hit us?
It definitely is. And it depends which group of people you're talking about. If you're talking about healthcare professionals, really the people, the administrators running hospitals have to now have a plan of action. Funny enough, I'm involved in a group currently in the National Health Service where we're actually meeting in a couple days, but a whole group of us are virtually creating a kind of protocol of how we help healthcare professionals, for starters, because they're at the front line, they're in real trouble and will be in trouble further down the line. But take the workplace, for example. How about people who are working remotely now, who are feeling job insecure, wondering if their job will exist after this, who are socially isolated and therefore not with colleagues. So then we have a whole other group of people who have to develop a strategy for this, and that would be the HR professionals, human resource management professionals in all businesses, public sector, private sector, have to think through a strategy. And it's not that complicated. Training line managers, bosses, whether it's at your TV station or my university, to recognize the symptoms in their employees, to ensure that there are counseling services available and they're rapidly identified and sent for treatment.
Right.
So there are things we can do, and we can do it pretty quickly, but it is a strategic issue for employers, for government, and really for the health services, because those people are really high risk.
Right. Professor Kerry Cooper, is such an important message to send out, how different segments of society need to recognize what is to follow after this. They can work during this time in order to train their staff, to train their HR managers, to train different sectors can be trained in order to help those who will be suffering even after we see this pandemic coming to an end. Thank you so much, Professor Kerry Cooper, for joining us from Manchester and talking to us about this. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.